The environmental swab plate, sometimes simply referred to as a swab plate, is a great way to do a couple of things. One is to determine the diversity of bacteria in some sort of sample, right? So if you want to know how much bacteria is right here, or how much is on your phone, or your hand, or a park bench, or something like that, you'd use an environmental swab plate. The other thing it does is it gives you a rough estimate as to the quantity of bacteria, right? So if there's a lot of bacteria or a lot of colonies on your plate the next day, that means it's going to be there was a lot of bacteria present in that sample. If there's very few colonies, that means that there wasn't that much bacteria present in that sample. And you can also look at the diversity. I think I already said that, right? What different kinds of bacteria are present. In some environments will have a whole bunch of different kinds. Some will have very few kinds, a whole bunch of just one kind. To perform an environmental swab plate is pretty simple. Here we have a sterile swab, right? Sterile cotton tip applicator. Basically, it's a Q-tip that's sterile. Right? So if you feel this side here has the cotton part, this is the handle. Make sure you always open the handle side. And again, open only when ready. Right? Once I'm ready, I've identified this is the area that I would like to sample. I'm going to open it from the handle side, not the swab side, because I don't want to touch it. It has to remain sterile. Pull it out, and then when you hold one of these things, what I like to do is hold the back of the swab, keep my finger here so there's a little bit of pressure. There's a couple of things. First of all, when I swab, again, a little bit of a pressure. Second, after I swab this way, I know my sample is on this side. All right? So then I know exactly where or how to apply it onto my plate. Pre-labeled, on the back, lid down. Right? Just like we had already talked about. When samples are wet, you simply swab, just like that. When samples are dry, like this table, it helps to make your swab a little moist, right? So you just open up your sterile water, stick your swab in, touch it to the edge, and turns. Then you have a nice moist but not dripping wet swab. You don't need to flame that. Often you're going to be away from your bench area anyways. And then simply swab the area. Just like that. One time is fine. This is where my sample is, just there. I'm going to now take my plate, one time top to bottom, cover. And notice I'm going completely edge to edge, right? So you want to make sure that you go all the way to the edge and then close. So not just on the middle, not these big weird zigzag lines, all the way one time top to bottom. And then now on here, I've inoculated this plate with a representative sample of what's on the bench right there. When you're done with this is a biohazard, so we're going to put that back in the bag, and then this goes into biohazard discard.